Hello. Um, this PowerPoint presentation is in partial fulfillment of the informatics course being done at the Aspen University to pursue my bachelor's, my BSN degree in nursing. This presentation is basically about being a project manager in charge and implementing a new system. We'll start by just outlining the objectives. The objectives are explain the importance to understanding usability, configurability, and interoperability. List the characteristics to consider in the phase 1 when selecting a team. Phase 2, lead with culture, determining where the resistance is and then engaging all levels of employees, as said by Sipes in 2019. Explain what this principle means and how can it be implemented. Explain how to manage physicians and other key professionals resistance to change and using this new system. Discuss pitfalls during the implementation phase, and how to avoid them. Describe personal experience with automation and new information systems. So we'll start with the first slide, and that says understanding usability, configurability, and interoperability. Alrighty. In implementing a new system, it is very important to understand usability, configurability, interoperability. Usability simply refers to the ease of using of a system. Configurability means the user should be able to tailor a particular system to fit their specific needs, workflows, and policies, while interoperability refers to the ability of different systems to exchange data efficiently and effective. For example, OBIX communicating with Epic and transferring data. Newly developed health systems ought to take these into account. While cost is an essential consideration, it should not be the sole determining factor. A system that takes all these components in consideration should be more expensive to implement but may lead to long-term benefits. Usability. Enhance efficient workflow by reducing time spent entering data. User-friendly, easily navigated and easily learned by new users. That is very important. Reduce the likelihood of error by ensuring accurate documentation, and users should be satisfied with the use of the system. Configurability. The system should be able to be customized to fit specific workflow, able to adapt to a change in organizational requirements such as change in patient census, and able to share data between existing systems. Different units chart differently and will enter different data. So, a good system should be able to be configured to fit different units and different areas for to fit their workflow. We go on. Interoperability. This should enable efficient communication among healthcare teams, facilitate secure data exchange between healthcare providers, ensuring comprehensive patient care, increase efficiency, streamlines clinical workflows, reducing the time spent on manual data entry. And as nurses, we know how important it is to be able to go back and look at the, other healthcare workers' notes, look at labs, communicate with each other for, positive patient outcome. All right, so we move on. All right, so the the system I would recommend is Epic. This system is user friendly. It provides a single integrated system of patient recording, making it easy for healthcare workers to access and manage data, improve safety by reducing errors, improve communication between healthcare workers by using of secure message and communication. At my job, we use a lot of, we communicate a lot with members of the healthcare in different areas via secure chat to get a instant message and such like that. This system is user friendly, easily learned. I mean, initially it kind of intimidating, but as you get it, it becomes your best friend. Enhance, improve patient safety. Is for example with given administration of medication. It comes with a scanner, scanning barcode, and it will flag you if it's the wrong patient, wrong time, wrong medications, stuff like that. It facilitates clinical decision support tool to assist providers to make informed decisions. Epic integrates with a wide range of third-party systems, allowing seamless data exchange. It, as I said earlier, this is what I have knowledge of. It's OBIX. It's a different system, and it feeds Epic with information. Yes, it has strong security features to protect patient data. Now we're going to discuss important characteristics when selecting a team. It is crucial to consider some important characteristics when building a strong and effective team. By considering these characteristics, a well-rounded team with necessary skills, expertise, and dynamics to drive project success. Select team members with excellent communication skills. Identify members with specialized expertise such as IT, project management, and clinical informatics. It is also important to identify members with leadership skills to motivate the team and make informed decisions. Choose members who are committed to the goal and are able to adapt to changes in requirements. Phase 2. Lead with culture, implementing this principle. The principle of leading with culture and determine resistant and engaging employees. This principle emphasizes the importance of understanding cultural dynamics and potential resistance with an organization before implementing change. Lead with culture means that an organization's culture plays a crucial role in shaping employees' behavior, attitudes, and acceptance of change. Determine resistance means identify the resistance. There sometimes can be a pocket of resistance, employees who are they just want to have it that one way it works. It has been working for ever since that one way, and they just want to stick to that and they don't want to change. So you have to identify, and a lot of the times these people are very influential. Sometimes I've been there for a long time, and they can change how this project, because they can be very resistant. So You have to understand and find these other pockets and communicate and reach out to them. Let them understand the reason behind the resistance. Let them understand the the reason for this project, and also for you to understand the reason for the resistance and develop strategies to address them. All right. My next slide, managing physicians and other key professionals' resistance to change. Involving physicians and other key professionals in planning and decision-making process is very important. Nurses, doctors, and all levels of the professionals within the healthcare system. You should communicate clearly, identify reasons for the change and the benefit of change, offer training and ongoing support. A lot of the time people are resistant because I'm like, I don't know how to work with computers, I don't know how to do this, and then understand we're not going to throw this on you. There's going to be ample time to train, and there's going to be somebody to always support you, will help. Identify and address concerns. Establish a strong system to quickly resolve any technical issues. That is very important. Sorry. Pitfalls during the implementation phase. Several downfalls may occur during the implemental phase of a new system. Strategies have to be put in place to avoid these pitfalls. It is crucial for the engagement with stakeholders to get them on board to avoid these resistance. Inadequate training may lead to increased error and user frustration. Ineffective communication can result in misunderstandings and delays. Unforeseen technical issues can cause delays and cost overruns. And that's why it is important, as we discussed in the slide before this, to have, IT to help with, issues. Inadequate testing may result in system crashes and glitches. Stakeholders resistance due to the ineffective communication resulted in project failure, and we did discuss that earlier. Now we're going to discuss the strategies to avoid pitfalls during the implementation of the phase of this project, implementing phase of the project, Develop a comprehensive training plan for end users and super users. Establish effective communication channels, encourage open communication to prevent misunderstanding. Ensure thorough testing is conducted to prevent errors and user frustration. Because you don't want the people who are, already blockers, like, see, it's not working, I told you it's not good. So you have to prevent that, to give them something to say, yes, it's not a good system, we need to stick to the old one. Engage stakeholders and keep them updated. All right. As a result, now I'm going to discuss my personal experience with automation and also a new experience with the new information system. I have used paper charting in the past, and for a long time in my nursing career. And I think one of the best things in my nursing career is learning electronic health records and using it efficiently. Automation increases in efficiency, reduces manual labor, and minimizes errors. I remember the time when I had to write notes, had to write off doctor's orders, and it took a long time. Sometimes handwritings are ambiguous, and you might transcribe an order that is not correct because of how it was written. It enhances communication among healthcare workers and with patients. Patients are able to communicate with their providers and able to see their medical records. It is automatically shared with patients in the patient portal. It also saves costs and reduces waste since automation can improve supply chain management. Automation enhances productivity by allowing employees to perform other tasks that may require creativity, may reduce labor costs and minimize waste. Automated systems perform tasks with higher accuracy. Streamline processes to reduce errors such as medication errors and diagnostic errors. It enhances communication among healthcare workers and also with patients. Personal experience with new information system. Even though Epic is not new, but it was new to me when I learned it in 2019. While it is not new, its software is constantly evolving and new versions are released regularly, which offers new features, functionality, and improvements. As nursing staff, we work closely with IT specialists when there are issues and when there are updates. One new system that I was able to take part in was the launching of OBEX in the labor and delivery unit as a youth system to monitor mother and fetus. This was a little challenging to learn initially, and there were some who were resistant to this change. And we have come to the end of this presentation. I want to thank you for listening, and please reach out if you have any questions or follow up to anything that I have said. Thank you.